KwaZulu-Natal has recorded 1,302 new cases of COVID-19 as at the 7th of July. Now, the province has recorded an average of 937 cases per day, and this is in the past 7 days, including over 4,000 new cases in just 3 days this week. Joining us for an update on the situation in KwaZulu-Natal is the Health Head of Department, Dr. Sandile Shabalala. Dr. Shabalala, thank you for your time today. How are you dealing with the rapid rise in the number of cases that are being experienced in your province?
Firstly, let me greet you, Tammy, and greet the people who are watching your program. We, as a province, are worried that our numbers are going up, but we must say that what we've observed is that our numbers are growing up, among other reasons, because in the community, the level or the degree at which the compliance with the COVID rules is done is not as much. But also we've realized that the messages that are encouraging people to comply, but also to come for vaccination, people seem to be tired about it. But we are therefore still intensifying our messaging, encouraging people to comply with the regulations, encouraging people to come for vaccination, encouraging people also, those who are infected, to come for admission, but also those who are self-isolating to follow the guide which we have developed. But on top of that, we then are making sure that we trace the contacts of those that would have been found to be positive. With that contact tracing, we then find new cases. So we're doing everything, and we must be grateful to the guidance of our Premier and the MECs, because the Operation Sukuma Sake structures and the development management structures, the development model is assisting us. We think we would be having even more cases if these structures were not being used to ensure that communities are engaged with.
You mentioned, Dr. Shabalala, apathy around the messaging about vaccination as well as COVID-19. How then are you going to be adjusting your strategy, the COVID-19 awareness strategy, as well as the vaccine awareness strategy, in order to yield the results that you want to receive?
Look, the apathy mostly comes because we come with a positive message. Then you get messages which are more like fake news. Then you get messages which are inflicting fear on the people who are supposed to even go and check. But there is the issue also of the stigma that comes to be associated with being COVID-19 positive, and some people fearing to be admitted. So we are making sure that where possible, we go to the communities and we engage with them, addressing all these fears, addressing these fake news. But we also are asking the influencers in our province to also, when we leave them in their districts, to also engage the communities. We engaging the councillors, we engaging the traditional leaders, we engaging the traditional healers, we engaging abefundisi, and all of these are people who we are saying can influence the society. Even some of the people who are celebrities are being engaged to really preach the correct message, and also, if needs be, to even allow themselves to be vaccinated in public, so that the public can realize that even after vaccination, life continues as normal. And we're using all the platforms that we can put our hands or our resources on.
Let's focus now a bit on the vaccine rollout. What are the type of challenges that you are experiencing in that mission?
You'll remember that we started vaccinating with the healthcare workers. And when we started, we wanted to vaccinate around about 162,000 healthcare workers in the province, both in the public and the private sector. We then went on to vaccinate those that are 60-year-old and above. And of those, our calculation were telling us that we have to vaccinate more than 955,000. We have found that because, again, of fear and the fake news, both these categories that we are vaccinating and wanting to vaccinate, people are not coming forth to be vaccinated, such that we have not met all the targets in terms of time in particular that we want to meet. The other aspect that we've seen is that our African old ladies and old men are not coming forth as much as we expect them to, again, because of the fake news that will reach them in their rural areas. Hence, our MEC in particular and all the MECs and the Premier are then going to all these rural areas all over the province to engage the people through the Operation Sukuma Sake to get to know what exactly is holding them back and address those issues, after which we do see some change in terms of the uptake of the vaccine and all the other messages that we then take forth to the community.
Dr. Shabalala, despite the efforts that you are putting in, as you are outlining there, do you have any concerns about the continued gatherings in the province? We see them ever so often. Concerns regarding those gatherings, as well as how they will affect the increasing numbers of COVID-19 cases in your province?
Tammy, you'll remember that the president did issue clear instruction to the country in terms of the gatherings that must happen. But we still do see people wanting to go to funerals and other gatherings for one or other reason. What we then do is to employ the skills and the influence of the people on the ground to ensure that, one, during those gatherings, people get to be compliant with the regulations, but when more numbers get to conglomerate in different places, also they are encouraged to disperse from time to time. When it's be, we also are working very well with the South African police services, and they are assisting. Just recently, we were getting reports that in some areas there were arrests where people were refusing to comply or adhere to the regulations. So as government in KwaZulu-Natal, we are employing all the resources to ensure that where gatherings have happened, they are discouraged. But also as the Department of Health, when such has then happened, we then follow up with the screening and the contact tracing if we find people to be positive, so that if there was a positive person, we make sure that that does not lead to any morbidity or mortality of the people that could have been involved. So that's what we are doing. But the most important aspect is the preventive approach, that is of sending the positive messages through the leadership in the province and all the champions that we are having.
Some of the provinces are talking about shortages in bed availability and oxygen. Are you experiencing any of those challenges?
We are not there yet, particularly as the public sector. We can report to you that the last time I checked, we were at around 22% utilization of our beds. This is just for ICU. For the others, which is isolation and PUIs, we were even at a lower percentage. But we must report that there are people who are self-isolating. And those people, we try as much as possible to also use the community caregivers and other healthcare workers in the province to also monitor how they fare, what their prognosis is, because we want to ensure that even if a person has been infected, there is no mortality that results simply because a person was sitting at home. So we're doing everything possible, and we are engaging with the community. Sometimes we find people giving us wrong addresses, wrong phone numbers, but we are working on that as well to ensure that we do not see situations where the numbers of people who die of COVID-19 increase, again, other illnesses are being taken care of in the process.
Well, thank you very much for that update, Dr. Shabalala. Dr. Sandile Shabalala there. He's head of Department of Health in KwaZulu-Natal.